First of all, I would like to ask your permission to use this video for educational purpose and on internet.
Yes,
Now, we are 1.5 years after our surgery, correct?
that's correct.
And I didn't fix all your problem. I didn't make you younger, correct?
No, that wasn't the objective.
But, and as well, this is hopefully, hopefully you take it a good way. Hopefully this is our last visit that I see you never again, because that means you don't need me. But I want to get a testimonial from you today
Yes.
about, tell me about before the surgery. What were the symptoms? What was going on? And what were you offered?
I had back problems for many years,
Okay.
and I basically put off having anything done about it. I would just try to do exercise and try to keep it going, but eventually it got to the point where I just couldn't move around as well as I needed to.
Yeah.
And I had the x-rays, and the x-rays showed that yes, it could be repaired. And I searched out for doctors to do that. I went to Essentia Hospital.
No names, please. You don't have
No
to take the
names. I'm
names
not
of the
gonna give
doctor.
any
Yeah,
names.
good.
No, I'm not going to give any names. However, in analyzing my situation, and after talking with you and the group at Alexandria, I made the decision to go with the non-invasive therapy, and I'm very, very happy that I did.
What were the options they gave you for the regular surgery? Cut you open
Cut
from...
me open from my groin upwards.
Okay.
And I'm too old for that. I didn't need all of that disruption in my body.
I have actually your data from the surgery. The surgery was less than an hour,
Yep.
and we lost about 1/3 of a cup of coffee blood. That's all what we lost.
Yep.
Do you remember the surgery?
I do.
How long did you stay in the hospital?
Overnight.
Just over the night. How long after the surgery did you go back to basic daily life?
Right away.
Right away. Now, after open surgery, usually people in average stay 4 days in the hospital,
Yeah.
and usually it takes them a good part of 6 months to a year to go back to basic
Yeah,
daily
I
activity.
would agree.
And as well, blood loss is 10 times more. Risk of infection with open surgery is 25 times more, not like 10%, 20% more.
Yeah.
And when did you notice that the pain is different or the previous pain is gone?
The sciatica was my biggest problem. Prior
Pain in
to
the legs.
Prior to surgery. After surgery, I had no sciatic pain whatsoever. And I was so glad. I was so happy that really was the reason that I wanted to have something done, was my sciatica.
Yeah. And that with the surgery, that was 55 minutes. And
And it was
you
gone.
so you woke up and you noticed the leg pain is gone?
Yeah,
Most of my patients are telling me that.
yeah.
Some of our colleagues telling me that the only way to take the leg pain is gone is doing that big surgery,
Yeah.
cutting the bone and so on. And you and over 1,000 patients of mine have this kind of testimonial telling that it's
No.
not necessary.
No,
So
it's not
we
necessary.
achieved the goal of
I
the
even
surgery.
asked you the first time after I had the operation if you actually cut the nerve and took it out, because I never had a pain again after that.
Yeah. Well, if I would have cut the nerve, you would have noticed that.
I bet I would.
Well, again, so thank you so much for the interview.
Yes.
And I hope in a good way that I never have to see you again.
Yeah.
Okay?
Well, I'm not blaming your spine surgery for my nerve problems in my leg.
Yeah.
Or my drop foot. I had shingles in my right foot. The shingles are what are giving me the problem now. And as long as it's non-related to anything in the spine, I have no need for you anymore.
Yeah. Well, I hope it's the case, okay? Well, thank you so much.
Yes,
I
you're
appreciate
welcome.
that.